The following program contains adult material. Viewer discretion is advised.
Hello, doctors.
This is my wife, Paula. My name's Michael. I'm 50 years old from Bandera, Texas. My wife and I think we've injured my penis.
Yep, I used to stand straight, but now it leans to the left, as if someone has bent it at an angle.
How could this have happened? Could you
Please
help
help us, doctors.
What's your most embarrassing sex question? Well, that one sounded serious enough that we called in a specialist. Please welcome board-certified urologist Dr. Aaron Spitz. And also join us are Mike and Paula, who you just saw on the tape. And thank you both for coming, but also thanks for asking the question, because this is something that's really important for us to talk about. And the first thing I'm going to ask you, Mike, is do you have discomfort during sex?
None whatsoever.
None?
No.
Well, you know, I'm glad that we're talking about this, and you did examine Mike before the show.
Yes, I had the opportunity to examine Michael before the show. And the good news is, although it's not broken, although leaning to the left in a red state like Texas can be a problem. So I'll do my best to help you. What you have is not a dangerous condition. It's not cancer of the penis. But it is a known condition called Peyronie's disease. And Peyronie's disease is a situation where some unusual scar-like tissue just sets up shop in the penis. And I have a model to demonstrate what this is all about.
So was he probably injured and then got scar tissue?
Well, in a small percentage of cases, it is traceable back to an injury, like there's a sudden bend, sort of being in the wrong place at the wrong time for a moment.
I mean, you actually can fracture your penis.
Yes, although this isn't the fractured penis, because that's a much more dramatic presentation.
Right. In that case, this goes straight to the ER, by the way.
Right, exactly.
If after having sex, boom, something happens, go to the ER.
Yeah, that's a difference. This is more of a subtle situation, and in most cases, it can't even be traced back to a knowable injury. This is just a model to demonstrate how the penis functions. The penis is actually comprised of a couple cylinders like this that fill with blood. In this case, to demonstrate, I'm going to use air. So the flaccid penis, once it's filled, takes more shape and rigidity, and it straightens out. In the Peyronie's disease situation, there's a spot on the penis where the tissue has become hard and is no longer stretchy. And although you don't necessarily feel or see anything when the penis is flaccid, it looks like a normal flaccid penis. When it fills, you see the angulation.
You get that little bend.
And that's the condition of Peyronie's. Now, in its most severe state, it can require surgery. Because this is a poorly understood condition, the non-surgical treatments have traditionally been disappointing. This is a system called penile traction.
Whoa,
yeah, I know I'm about to get a little medieval on you. So anyway, what you have is, here's another model. Now, in this situation, you have the bend in the penis. And this is just a model. It's exaggerated, but the glans of the penis is typically a larger caliber than the shaft. So it is placed in the device, and then it is cinched down in place with this little snuggie. And then it's held at the base of the penis, and you put the penis on stretch, on traction. And as you can see, it straightens out that curve. Now, it doesn't permanently straighten it out with one use. It's kind of like traction for the back or the legs.
Therapy.
Yes, it takes time. And over time, typically 4 to 6 months, with use about 4 to 8 hours a day, it'll gradually straighten this out. It may not be 100%, but for all the men this was used on in preliminary study, there was 100% satisfaction and improvement across the board. Now, this is called a fast size, and the fast size company has actually allowed me to give you, Michael, one of these, and I'll give you instructions for use, and this will help you.
Well, thank you very much.
Thank you so much.
I appreciate it.
And you know what? That's proof that if you don't ask, you can't solve the problem.
Great option to surgery.